Hi, I'm Susan Taylor with Scripps Health in San Diego, California. There's lots of information out there about what to do to prepare for the birth of your baby, but not so much when you're talking about the fourth trimester. Those are the first 3 months after you've given birth. Joining us to talk about this is Dr. Kelly Harkey. He's an obstetrician and gynecologist with the Scripps Clinic Medical Group in La Jolla, California. Dr. Harkey is also certified as a perinatal mental health professional who serves on the California Board of Directors of Postpartum Support International. Doctor, thanks so much for being with us.
Thanks for having me, Susan.
So let's talk about the fourth trimester. Why is this a unique period of development for the infant, and also, development for the mom too?
One thing we know is that the infant comes to the world without a fully developed brain, and the fourth trimester is a very important time period where it has to build those neurologic connections with the help of its mother. About 26 to 29% of the brain is developed at delivery, and the rest has to be done in the fourth trimester.
So you're saying that the newborn baby's brain is not fully developed at birth?
That's correct. The newborn baby's brain is only about 1/3 of the way developed in terms of its neurological connections. The pathways that tend to get repeated and reinforced are maintained, and those that aren't are discarded as the baby finishes its brain development. Important to that is the input from the caregivers, which includes responding to the infant's needs when it's crying, feeding, communication. All of those help the brain become the brain that is going to be the personality of that baby in the future.
So you want to bond with that baby. You want to talk to it, sing to it, cuddle it, do all those things that you normally would do, right?
Exactly. Bonding is crucial. I mean, and we know that the mom's brain is having changes that help with the bonding as well. So it's a really good change in both mom and baby to bring them even closer during this critical time period.
So what are the baby's needs in those first 3 months?
Well, babies need to eat, they need to sleep, and they need to cry. These are important elements because crying is the only way that the baby can communicate its concern for fear, discomfort, hunger. The baby was previously in an environment where it was getting all of those things without needing to ask. We know that babies can smell their mothers when they come out. We know that hearing is a more evolved sense than vision is at the time they were born. And we believe that they can even hear and recognize the mother's voice from their time in the uterus. So the baby has one way to communicate, and that's to cry in the beginning. You have to teach it the other words. And how you respond to that makes a big difference in the development of the neurologic pathways in the fourth trimester.
So let's talk about the fourth trimester a little bit more. There's a bunch of unexpected things that can happen to the mom. What are they?
There are certainly hormonal changes that occur. The high levels of estrogen and progesterone both plummet after the placenta is delivered, which puts the mom in a state of almost menopause. Namely, we see the onset of hot flashes, hair loss. Those are replaced by 2 other hormones which help support breastfeeding, which are also important.
What about hemorrhoids and constipation?
Hemorrhoids and constipation are certainly things that we see. Constipation is often related to the iron supplementation, and hydration and stool softener certainly help with that. Hemorrhoids, again, is a product of pregnancy quite often. Most of the time, those will resolve spontaneously, but we use topical application for comfort. And we try to, again, hydrate and avoid constipation.
And what about pelvic floor issues? What are those?
Pelvic floor issues occur throughout the entire pregnancy, in part because of the weight of the baby on the pelvic floor muscles. Pelvic floor issues can cause a whole host of symptoms, including some of the ones that you have already mentioned. When we have someone with pelvic floor issues, we try to get them into one of the physical therapy programs. We have very specialized pelvic floor programs at many of our Scripps sites, and we quite often will put patients in there postpartum. And the new move is actually to get them started before delivery, so that you can get them working on the exercises that will help them get to full recovery faster.
And then what about the mommy brain? What's that?
Mommy brain is one of the most interesting things. Traditional pop culture, mommy brain was kind of described as a brain fog or short-term memory issues, which are true. But we know now that the brain actually undergoes physical changes. We have studies from functional MRI and PET scans, which show an actual rearrangement of the brain, which is probably very important because the area of the brain that gets changed is related to empathy and bonding. So the brain probably becomes much better at establishing a relationship with the infant. And that tends to be a long-term change, whereas the brain fog itself tends to only be a short-term change and maybe more related to sleep deprivation.
And what about postpartum depression and postpartum anxiety?
It encompasses anxiety, it encompasses bipolar disorder, it encompasses obsessive compulsive disorder, and probably the worst of all, psychosis. These are all part of the spectrum of what's called perinatal mood and anxiety disorders, which is the new term. They are the depressive symptoms can be seen as high as 21% of all moms who deliver, and they certainly are receiving a lot more attention than they used to.
So how do you treat this postpartum depression, this postpartum anxiety?
Well, there are lots of ways to treat, and the first challenge is to identify the patient as having a disorder, and then to get them into some type of a therapy program. This can include support groups, it can include behavioral therapy, and it can include medication where indicated.
And then what about physical challenges that the new moms are facing? Talk about a vaginal birth versus a cesarean section, about neck and back issues.
Well, certainly there are issues related to the delivery itself. Again, physical therapy programs can certainly help with that. The C-section is clearly an abdominal surgery, so it has, for most people, a longer recovery time. We recommend people restart exercise programs regardless of the type of delivery, obviously taking into account complications or medical issues, which might limit some of the things they could do. Again, great thing to discuss with your provider.
And then let's talk about some of the myths out there about what happens after you've given birth. So one of the myths, tell me true or false. You're completely healed, recovered after a 6-week checkup, and you're ready for anything.
Well, that really depends on who you are. There are some people who are completely recovered at 6 weeks, but I would say that's not the norm. Most moms have a good amount of recovery by 6 weeks. And from an obstetrical standpoint, we're looking at two very important things. Physically, does it look like things have healed appropriately? And number two, is there a mental health issue that we can identify at that point that could be delaying or making the recovery more difficult? There are a lot of women who are not fully recovered at 6 weeks, and I think that you have to individualize that as well.
What about this one? You can't get pregnant again if you're breastfeeding.
That's false. Certainly breastfeeding delays ovulation, but there are newer studies that show that it's possible to even get pregnant as early as 6 weeks, but a lot of women have return of ovulation by 6 months, even if you are breastfeeding.
And what about exercising affects your milk supply?
Exercising can actually make your milk supply better. There are new studies which show that it does not affect your milk supply as long as you are staying well hydrated. That's the important key there.
If you don't have any symptoms, you do not need to get checked out by your obstetrician.
Well, again, we could go back to the whole mental health screening. A lot of the times you pick that up when the patient really hasn't been complaining about it. And oftentimes we'll see something that is not appropriate healing that the patient really hasn't picked up on. So plus, I think it's a good time to just discuss preventive health measures and to get the patient back into a healthy lifestyle, including nutrition and exercise, etc.
So you think that that 6-week postpartum visit with your obstetrician is really critical?
It is. It's sometimes not enough. Sometimes you have to have further follow-up. It's a good point of healing, and it's a reference point that in obstetrics we've used for a long time.
And what about the ability to bounce back immediately to your pre-baby weight?
Well, I think that's somewhat of a fantasy, probably something that you really don't want to do, because sustained weight loss is weight loss that you do slowly and change your behavior so that you eat appropriately. And the guidelines kind of say you should probably take the same amount of time to lose that weight that you did to put it on. Good exercise, good diet programs, and we can certainly, as an obstetrician, help you with some of that, and then refer you to some of our weight management if you're having issues with it.
And then postpartum depression only occurs in the first few months after birth. Is that a myth?
That's entirely a myth. Postpartum depression, or depression in pregnancy is probably a better way to put it, can happen at any time of the perinatal period, which is from conception to up to a year past the delivery date. The new studies show that if you put patients on medication, that you should keep them on them for that full year, because they have a very high rate of relapse if you take them off any sooner.
Are there any red flags, doctor, during the 4th trimester that you should be looking out for?
Certainly bonding issues, again, mental health issues, they're very prevalent there. One of the things we didn't touch on is baby blues, and that's important because that's very different than a mental health condition, because baby blues, about 80% to 85% of all moms will experience baby blues in the first 2 to 3 weeks.
And what is baby blues?
That kind of feeling overwhelmed, feeling a little bit helpless, having emotional swings. And a lot of that they think is related to the severe sleep deprivation that occurs. And as the baby starts sleeping better, the baby blues usually will get better also. It's those moms where the baby blues don't get better that you've got to start looking for other reasons that they're depressed or anxious.
It's advised that moms go see their obstetrician gynecologist 6 weeks after they've given birth. What do you need to know about that 6-week follow-up?
One of the things that we talk about is birth control, and we touched on that a little bit. It's very important to give them birth control options that are appropriate for how long they're going to breastfeed, whether or not they want to have more children in the future. So that's one of the discussions. The other is exercise and diet. We talked about that a little bit also. And to assess for any type of depression or anxiety that may need more attention or treatment.
Any final thoughts, doctor?
I would just say that the 4th trimester is a fascinating time for both mother and infants. The baby comes out with a brain that's unfinished, and it's your job to put the final touches on it. This is helped by gathering your support, both your family and friends, doing exercise that you like to do, and eating appropriately is also a good thing. And if you think you're suffering from any form of depression or anxiety, please discuss that with your provider, because we are really working hard to establish networks where we can help you with that.
Doctor, thanks so much for taking the time to be with us. We appreciate it.
It's my pleasure, Susan. Thank you.
If you'd like more information on the 4th trimester, those first 3 months after you've given birth, just click on the link or go to scripps.org/videos. Want more critical information about your health? Please subscribe to our Scripps Health YouTube channel and follow us on social media at Scripps Health. At Scripps, we're here for good. I'm Susan Taylor. Thanks for joining us.